I am a mom of 3 kids, and I stay at home and I take care of my kids. And I would say a few years after my daughter was born, my periods became very heavy, very painful, very stop and starty, really unpredictable, and pretty much would lay me up the first day or two. I decided to talk to my general physician about my situation, and she recommended that I contact a gynecologist and discuss it with them. I was comfortable with the fact that I needed to get something done. However, I was a little bit reluctant, not really knowing what my options were. I spoke to a friend of mine that had had a hysterectomy. She had had the kind with the big giant abdominal scar, and she was in bed for 3 weeks, I think, where she couldn't literally get out of bed except to pee. And that made me pretty reluctant to consider it. But I had another friend whose husband is a gynecologist, and I went to speak with him about it to see what he had to say. I explained to him about my friend and that I was really reluctant to have this gigantic abdominal surgery. I had had 2 C-sections. I've been through it. I really did not want another one or anything similar to that. And he told me that there is a cosmetic hysterectomy procedure that I could possibly be a good candidate for. And that was a huge relief to know that. It was a laparoscopic procedure, so it was just teeny tiny little holes way down low on my abdomen. And I've had a laparoscopic surgery before, 2 C-sections, a vaginal delivery, and I have to say it was the best surgery I've ever had. My cosmetic hysterectomy procedure was probably the best surgery I had for a variety of reasons. One would be I was very comfortable with my surgeon and the hospital that I was at. I felt like there were great lines of communication there, and my concerns regarding pain post-operatively were addressed. Women in general really need to become their own advocate for what kind of medical procedure they're going through, and they really need to educate themselves and ask the questions. And if you don't want to look like you've been through a battle, then tell them, hey, can't we do this in a different way? Empowering the patients to know that they have options. I talk to everyone about my hysterectomy, and I am quite happy to, tell them everything, nuts and bolts and, whatnot. I think people need to know, and they really need to realize that, yes, you're a patient, but you're not powerless. I totally received the surgical outcome that I wanted. I have no scarring. I feel fantastic. I, no longer bloat. It's wonderful. Life is great. If you're considering a hysterectomy, my advice would be talk to all your friends, because usually somebody knows somebody who's had one. Talk to them about their doctors. Ask them, do they have a gynecologist? Do they know one? Do they like one? Are they a surgeon, or are they still delivering babies? You really are looking for a gynecological surgeon, not necessarily someone who's still doing pap smears and going to the OR to deliver babies anymore. And do your research and just ask questions. And if people are very happy to talk about great stuff and very happy to talk about bad stuff. If there was an entity that, when I Googled hysterectomy, popped up and told me that there was, say, an organization of gynecological surgeons that specialized in hysterectomies, I would definitely click on it. I would definitely see what it has to say. If it had a zip code finder, I would stick mine in there, and I would very much think that would be a good tool. If you are done having babies and your periods are really interfering with your life, you need to consult a gynecological surgeon and find out what your options are, because you don't have to have your life ruled by that.